Summer in the Gulf states, that's Florida, Alabama, Mississippi, Louisiana, and Texas, draws a lot of tourists, and this year's numbers do not disappoint. But that influx of people into a region with relatively low rates of vaccination against COVID-19 is fueling a deadly spike in infections. Transmission rates in many counties are more than twice the national average, and hospitals are buckling under the strain. The Singing River Health System is among them. They operate 3 hospitals along Mississippi's Gulf Coast. Dr. Randy Roth is Chief Medical Officer there. Dr. Roth, welcome. And can you give us an idea of what it is like inside your hospitals right now?
Sure. It's probably the worst situation that I've dealt with in my 22 years of practicing medicine. We have no beds. We have no ICU beds. This morning, as I drove in at 6 a.m., we have over 22 patients that are waiting in our emergency room to be placed in a true hospital bed. And what that means is people are getting cared for by great ER nurses, but that's not what they're supposed to be doing. They're supposed to be taking care of emergency room patients. So when you hear that term boarding, they're sitting in the ER waiting to go to the ICU or waiting to go to a step-down unit. And those beds are being occupied by COVID patients who this wave are just living longer. It's a younger subset of patients, and we have a hard time getting them out of the hospital, and that slowed the process down. The other thing you hear about is just nursing shortages. We have 8 ICU beds we can't open because we can't staff them. The morale is strong, but when you have mandated overtime and you're walking into the ER and you have 18 patients that have been there overnight the next day, it's tough. And lastly, it's just the isolation of the disease. So someone with COVID may stay in the hospital 21 days and the only contact they have with their family is via cell phone or FaceTime. It wears you thin, and we are frustrated, but we're working hard to hopefully get past this wave.
We're hearing from not just healthcare professionals, but patients as well. One family posted a video of their child who has cancer and had to wait in the parking lot for hours because he couldn't get in to get treated. What are you seeing as sort of the trickle-down effects of this kind of overflow?
The biggest problem I have with this is, are we prepared for something on top of COVID? If we get a Category 4 storm, can we take care of the 300 or 400 people that need immediate care? If we have a bus that hits a train and I need to intubate and put 14 teenagers on the ventilator that clearly can survive, do we have capacity to do that? People are putting off elective surgeries that are time sensitive because we can't do them. Is that colon cancer or breast cancer going to spread in the interim time that we wait to do that? I've had to cancel over 15 coronary artery bypass grafts or bypass surgeries because we can't bed these patients and we don't have nurses to take care of them in the ICU. And these are patients that are clearly fixable and curable, but they're waiting at home for the call to say, we have a bed for you. I worry about that constantly.
And we've heard some tragic stories coming out of your own hospital. There was a husband and wife in their 40s, both unvaccinated. They died within days of each other. And one of your own nurses was unvaccinated, 48 years old, also died. What does your hospital need most at this moment?
You know, our biggest need right now would probably be bedside med-surg ICU nurses that we could staff and open up more beds to unclog our emergency department. That would be our biggest help. In terms of supplies, we're close on ventilators, but I think we have that covered. The nursing shortage, and then anyone else in terms of boots on the ground that can help us do vaccinations or the monoclonal antibody infusions. Because when we take and we start giving IV Regeneron, we need nurses to do that. So we're taking nurses that could be at the bedside to administer the antibodies. The last thing is to educate people about being vaccinated. I know Pfizer announced that it got FDA approved today. Maybe that'll help our numbers. But the vaccine's been well studied, and it's very frustrating that people will not be vaccinated, but they will take ivermectin or all these over-the-counter things that have been started on the internet. Very frustrating for the frontline staff to have to deal with that. A lot of these are avoidable cases. 95% of our patients in the hospital with COVID today are unvaccinated, and the numbers don't lie. That's where we stand.
Dr. Randy Roth, Chief Medical Officer at Singing River Health System in Gulfport, Mississippi, operates 3 hospitals there, all at capacity with COVID-19 patients. Dr. Roth, I really appreciate it. Thank you so much and good luck.
Thank you, Celeste.